Thank you for the invitation to share a few answers to difficult questions about mental health of people who are deaf or hard of hearing. Yes, a series of studies shows there's about double the rate of mental health issues in people who are deaf and hard of hearing, starting already in childhood and mainly in those who have difficulties to make themselves understood already in childhood. Of course, the life course with its challenges and stresses increases the rates of mental health problems, mainly due to stress, not to typical psychiatric disorders. There is, of course, a huge need of access to mental health care, which is in most places very difficult, because access to mental health care means to have access to a full communication. And for most people who are deaf, this communication is based on sign language and on people who are able to work in sign language and be also specialists in mental health care on the one hand side. But the other hand side is also very important. Mental health care includes environment of friends. And this environment of friends is also dependent on those who are able to communicate. So the deaf community is a very important resource of mental health care. And this access to society, access to being part of a social network is one of the focuses we have to develop further in mental health care. Of course, I think also of the specialists. If you have a special mental health problem like depression or anxiety, you would need an expert who helps you to overcome this condition. But mental health care means prevention and basic development of self-confidence and competence in life, including aspects of social inclusion, and the other side is treatment in social and especially mental health problems. To our experience over 30 years, we have seen many mental health problems manifesting themselves in physical symptoms. This distress I was mentioning before is not often expressed verbally or in signs, I feel so nervous, but mostly in pain symptoms or symptoms of dysfunction of body systems. So we have to be very aware that somatic symptoms can be an equivalent of mental health problems. Another symptomatology we frequently see is behavior others rate as being challenging. This kind of behavior phenomena are mainly due to the reaction of an individual to stress, like fight or fleeing from a dangerous condition. Whereas the first thing I was mentioning, the symptomatology in body symptoms, is more the withdrawal due to stress. The other symptoms, like aggression and so forth, are mainly due to a stress reaction we all have when we get anxious or we want to flee or fight. So we have to keep all this in mind and have to think about mental health in a wider way by using all the resources of the deaf community and those who are willing to build up really good social relationships. Thank you.